In the early 2000s, wearable technology reached a new high when Runkeeper app was launched in 2009, which used GPS tracking to track runs outdoors for activities. In 2010, the Nike Run Plus app was launched to track steps on your daily walks. Greetings, I am George Williams II, and this is my research presentation titled Applications of Wearable Technology for Precision Medicine and Personalized Healthcare Monitoring. To begin, we will discuss wearable technology's key topics. Is it viable? How is it viewed? Long-term impact. The research questions that will be discussed: in what ways can wearable technology support precision medicine and personalized healthcare monitoring? What are the patients' and clinicians' perception about collection of patient-generated health data through wearable technology? What issues are related to the use of wearable technology for continuous self-monitoring of physiological data? Now we will discuss, is it viable? A study was conducted at a level 3 care hospital. Patients who underwent cardiothoracic surgery were given Fitbit watches to wear continuously pre and post surgery. The data collected was evaluated by the night signal algorithm, and as a result, the algorithm was able to detect 17 of 21 post-operative events 2 days prior to onset symptoms, representing a sensitivity of 81%. Next, we will discuss how this technology is viewed. What are the patients' and clinicians' perceptions about the collection of patient-generated health data through wearable technology? In order for wearable technology to become a standard data source in healthcare, it will require buy-in from two primary stakeholders. One are the clinicians, two are the patients. Clinicians have been more skeptical about patient-generated health data for a few reasons. One is the accuracy and trustworthiness of wearable device data. Companies like Fitbit have explicitly stated that they are neither medical devices nor are they intended to diagnose, treat, cure, or prevent any disease. Patients have been more receptive, and their data has become a point of contention because patients' expectations are that the information will be reviewed and interpreted back to them by the healthcare physician or clinician. But clinicians have stated that the timeline required to evaluate the information is not congruent with the clinical workflows that are currently in place. Some clinicians have embraced wearable technology as a source of information about their patients. As more clinicians become more receptive to wearable technology and patients continue to embrace at a higher rate, we will have to discuss the long-term implications of using wearable technology over an extended period of time. So last, we will discuss the long-term impact. What issues are related to the use of wearable technology for continuous self-monitoring of physiological data? Two big impacts are: one, regulations, and two, cost. In a study that covers the security and privacy of patient-generated health data and the requirements and challenges that exist, they stated that the advancement of regulations for technology has been complemented to ensure that patient-generated health data is handled with the same care and security as traditional health data. And with heightened security measures, there will always be a cost associated. One area is data storage. Another is the cost of the devices. While data storage may not be a big concern for most patients, but purchasing wearable devices to be able to track their health data may be a concern because not all patients are financially able to be able to afford wearable technology. For healthcare facilities, data storage is a requisite expense, And many healthcare facilities do not have the same systems. And as technology grows, there will be a cost associated with purchasing new equipment and synthesizing old information for the new system. This process is called backloading. It consists of changing data storage formats for laboratory, normal ranges, and other differences between the older data and the new electronic health record system. As these changes are being made and patients and clinicians begin to harness the power of patient-generated health data, it can be used to create better healthcare plans through collaboration with patients and clinicians. It can be used as a preventative tool to ID onset symptoms through monitoring. Also, it can be used as maintenance to maintain a better quality of life. So my takeaways and the things I've learned from this class is that healthcare is very disjointed and has many areas that need to improve. And I feel that health IT is going to play a major part in making the improvements to give a better quality of care. With proper implementation, wearable devices have the potential to change the way we approach healthcare. Also in this class, I realized how important it is to have access to your health records and being able to have that information readily available when you need it. And last, I've learned that I need to take ownership of my health. The one thing that particularly stuck out to me was the story about the young lady who had diabetes, and she went to the nurses and they gave her too much insulin, even though she told them that she was too small and that was too large of a dose for her. And so for me, I feel like being able to speak up and have that ownership and understanding how things work for yourself is a big piece, and I plan on using that for my family moving forward.